Good morning, and welcome to the Greater Chicago Food Depository. My name is Kate Maehr. I am the Executive Director and CEO of the Greater Chicago Food Depository, and I'm delighted to have you here, and there's so many of you that I hope after this is done we can put you to work out in our warehouse with our other amazing volunteers who are here today. I want to share just a little bit about what we are seeing across Cook County today in the face of the COVID-19 disaster. As many of you know, in the best of times, before this virus came to Illinois and came to Cook County, we were doing a booming business at the Greater Chicago Food Depository. In fact, 800,000 of our neighbors here in Cook County were turning to food pantries, soup kitchens, shelters, and other programs to get the food that they needed to get by. So it's probably not terribly surprising when you hear that over the course of the last 8 weeks, we have seen a staggering surge in need. Yesterday, I got a report that shows that despite the fact that we have fewer outlets, about 70% of our partner organizations are operating. Together, that network is seeing almost a 60% increase in the number of individuals turning to them for food assistance. Every day, we learn stories of individuals, some of whom are turning to food pantries for the very first time in their lives, some of whom perhaps needed a food pantry a long time ago but haven't needed one since, turning to us in a moment of acute personal crisis. I'm grateful to the fact that we have amazing volunteers and amazing partners who are making our response possible. You had an opportunity earlier to see the men and women who are packing boxes in our facility right now. But I also want to say our ability to respond is really incumbent upon the fact that we had strong partnerships in place before the crisis. And one of those strong partnerships is with Cook County government. The work that we have done over the last 5 years with Cook County Health and Hospital Systems has been at the center of our food and nutrition strategy. And so I'm so grateful to have Dr. Rubin here today to talk about the work that she's leading, but also the work that we do in partnership. There has been no stronger champion of this work than Cook County President Tony Preckwinkle. And so I'm so grateful and so humbled to have her here today. So please join me in welcoming President Preckwinkle.
Thank you. Good morning, everybody. I want to thank all of you for joining us today. I'm glad to stand here with the Greater Chicago Food Depository, an organization that's doing so much for our communities during this difficult time. I want to acknowledge Kate Maehr, Executive Director and CEO of the Greater Chicago Food Depository, Dr. Rachel Rubin, co-leader of the Cook County Department of Public Health, and we're grateful to Michael Albert and David Jones, who will be doing our sign language interpretation. During this pandemic, the depository is partnering with Cook County, the City of Chicago, the Chicago Public Schools, and others to provide food for anyone in need during the pandemic. We know that even before the pandemic, Black and brown communities were disproportionately impacted by food insecurity and poverty. Even before this pandemic, 1 in 8 people in Cook County experienced food insecurity on any given day, 1 in 8. This inequity has made even more stark during a public health crisis. The need for food assistance has dramatically increased. In recent weeks, responding to the pandemic, the Food Depository's network of food pantries and similar programs has averaged a tremendous increase in the number of people in need. Last month, the depository established a grant program to support food pantries in Cook County and ensure that they remain open. They allocated $1 million for grants of up to $5,000. This program has gone a long way in supporting communities and residents most in need during a challenging time and ensuring residents have access to food. It's important to highlight that 60%, I'm going to say that again, 60% of the funding is being directed to organizations serving African American and Latinx communities. The depository has also used neighborhood pop-ups on the south and west sides of the city of Chicago to provide convenient pickups for residents. With many residents finding themselves suddenly out of a job or struggling to find work during the pandemic, the depository's benefits outreach team is working hard to help residents obtain the benefits they need, such as SNAP or Medicaid. Additionally, the depository has waived costs for food during the pandemic. While most of the food depository distribution is free, some pantries have purchased more food at cost, and that cost is now being waived. The depository has always had a tremendous partner in Cook County. We collaborated through Cook County Health with the Greater Chicago Food Depository to launch the Fresh Truck program, and which to this date has distributed 600,000 pounds of food to our community health centers throughout the county since 2015. I'm especially grateful for their support during the COVID-19 pandemic as we navigate the challenges of keeping our communities healthy. And I would be remiss if I didn't call for volunteers. The depository is always in need of volunteers, but now more than ever. You know, many of the volunteers for the Greater Chicago Food Depository are seniors, and of course they're in the most vulnerable category for the pandemic. So we need, frankly, younger people to step up. There are a lot of folks who are out of school, either high school or college. We really need your help. I urge those who are healthy and able to get involved. If you can't volunteer personally, as I said, encourage younger folks in your lives, your children, relatives, friends, or neighbors, to volunteer. Now I'd like to turn the program over to Dr. Rachel Rubin, the Cook County Department of Public Health. Thank you.
Thank you, President Preckwinkle, and thank you everyone with the Greater Chicago Food Depository. Your work is tremendous and life-saving. So at the Cook County Department of Public Health, we have long been aware that communities with higher rates of food insecurity are disproportionately affected by illness and disease that put them at increased risk for complications and even death from COVID-19. These include our elderly and our lowest income communities, especially our communities of color. Workers in low-wage service occupations and the hospitality industry are more likely to be from minority communities and to be food insecure, and are at increasing risk of further hardship as businesses have been forced to close and lay off workers. We are seeing the demands for food assistance increasing since the beginning of the pandemic, as many of these workers are no longer working and have no income. African Americans have historically had higher rates of chronic disease and are getting sick and dying from COVID-19 at higher rates than their white counterparts. African Americans in suburban Cook County, which is the Cook County Department of Public Health's jurisdiction, are getting ill with COVID-19 at a rate more than 3 times that of whites, and Latinx are getting ill at a rate 2.5 times that of whites. These health disparities are the result of years of racist and prejudicial policies, resulting in economic disinvestment, lower access to health care and health insurance, substandard housing, and higher rates of unemployment in our brown and black communities. Prior to COVID-19, over 1 in 8 Cook County residents were considered food insecure. In some communities, more than half of all residents were food insecure. Now, more people are food insecure due to business closures, workforce reductions, and subsequent loss of income, making it more difficult to afford and to access food. In places where food access already was scarce, The need for emergency food systems and food pantries has increased. Grassroots community networks have expanded to help neighbors access food resources, and organizations like the Greater Chicago Food Depository have rapidly adapted to meet these growing needs. I would like to acknowledge the Greater Chicago Food Depository for their essential and life-saving work. We must all work together to transform our food systems and heal our communities. Thank you.
All right, are there questions? Turn the volume up, okay.
I want to preface this just by saying I think there was a bit of a technical issue and we didn't hear any of the president's remarks for whatever reason, so maybe this was already answered, but I'm wondering if someone can just talk a little about the county's specific role in helping either food distribution efforts broadly or the depository's operation specifically, what kinds of support mechanisms are there.
All right, so the question is, what's the county's relationship to the food depository? Is that it?
Essentially, yes. If you can, talk about some specific ways that the county is offering support to the, food distribution programs and the food depositories in particular.
Dr. Rubin, do you want to talk about the I tell you what, Kate, why don't you talk about the partnership, the food truck partnership, okay? Thank you.
Hi, it's Kate Maehr, and I didn't hear the full question, but I think the question was having to do with the relationship between Cook County and the Greater Chicago Food Depository. And so I'll just take a minute and talk about the work that we launched in 2015, which was a collaboration between Cook County Health and Hospital Systems and the Greater Chicago Food Depository. And it grew out of the recognition that you heard both the President and Dr. Rubin talk about, which is that far too many of the individuals we serve are struggling with diet-related diseases that can be alleviated by proper access to nutritious food. And so we saw record numbers of people turning to food pantries who had diabetes and hypertension. And we knew that there was an opportunity to meet people where they were at, to ultimately help diagnose their medical condition, but also connect them with nutritious food. And so we launched what we now call our Fresh Truck program, where every day across the community at Cook County Health and Hospital sites, a food depository truck filled with fresh produce rolls up, and physicians and other medical staff at the clinic have provided patients with information about the truck's arrival and have given them the suggestion, almost like a prescription, that they can get filled at the truck. That has been life-saving and frankly life-altering for thousands of people turning to the clinics. And one of the things that I'm really proud of is that even in the COVID crisis, that program is continuing. We have volunteers showing up, trucks rolling out to the community, still filled with amazing fresh produce. We're open for business.
Thank you. Are there other questions?
This is Craig Dellamore from DBM Radio.
Yes, Craig.
I wanted to ask, good morning. And yes, we definitely did not hear anything you said after good morning.
All right, so I tell you what, Craig, I'll have Hannah send my remarks to everybody who's on the line, okay?
Okay.
All right,
thank
good.
You.
Okay.
And this question I think is probably also for Kate Maehr, because she talked about how bad things were before and now with COVID-19, they're pretty much off the charts. How well, even with all this assistance from the county, has the food depository been able to keep up with this, historic demand? And I mean, are there times when you don't keep up?
How well have you been able to keep up given the historic demand, and are there times when you don't keep up?
Thank you very much for the question. And I will share that the supply chain, as I'm sure you all know from following the news has been one of the really significant challenges in this disaster. In the immediate days after the shelter-in-place order was announced in Illinois, and we saw so many people turning to grocery stores quickly to stockpile food, it had a huge negative effect on our ability to get food into the food depository. And in those early days, there were a lot of sleepless nights. I am pleased to say that there has been a normalization of the supply chain. We are now getting truckloads of food in, which is a relief. Beyond that, the United States Department of Agriculture has announced a couple of critical investments in the supply chain, and that food will be flowing to food banks like the Greater Chicago Food Depository in the days ahead. I would also suggest that as much as we are focused on food and getting that food to pantries, the most important response that we have to hunger in America before this crisis and now in this crisis is actually not the box of food that you saw in our warehouse, but it is the SNAP program. You have heard me talk about SNAP a lot, and we are at a critical moment right now because we really need Congress to take action to expand SNAP, to make SNAP available to more individuals, and frankly, to have a higher level of benefits going out to families all across this country. We have had conversations with the Illinois delegation urging them to take action, as well as urging our administration in Washington, D.C. to take action. SNAP is so powerful because not only does it immediately alleviate hunger in the household, but those dollars have a powerful impact on our economy as well. Every dollar of SNAP benefits gets spent in a grocery store, in a community that is able to hire people and put them back to work. It simply is the most powerful tool that we have, and we need Congress to take action to make sure more people have access to this program during this national emergency.
All right, are there others on the line besides Craig and Alex?
This is Rachel Hinton with the Sun-Times.
All right, Rachel.
I guess, hi.
Hi.
Do you mind talking about, I guess, what the county is doing, maybe more specifically to help people who are experiencing, like, food insecurity right now? Obviously, food banks are a big part of that, but are there other things the county is pushing people toward?
Well, as you know, so the question is, what is the county doing besides working with the Greater Chicago Food Depository, the Fresh Truck Program? The county has used its community development block grant resources to help set up a program that will provide assistance to small businesses, those which have employees under 25 employees, and gig workers in the suburbs. Our community development block grant money can only be spent in the suburbs, and that program provides $20,000 zero-interest 5-year loans to the small businesses and $10,000 zero-interest 5-year loans to gig workers to help tide them over. So plus we have a technical assistance network for businesses to try to help small businesses to try to help them navigate these choppy waters. So that's part of our technical assistance network. That's part of our recovery efforts. But we have a long-standing partnership with the Greater Chicago Food Depository. Actually, I can't remember how long ago was it, Kate, when you came to see me?
Probably 5 years ago.
5 years ago, Kate Maehr came to see me to talk about the fact that the county needed to step up in terms of food insecurity in the county, and there was a task force that looked at food insecurity across the county, and that was one of the things that came out of that task force was our partnership around the food trucks that come to our healthcare centers and support the health of the communities in which the centers are located by providing fresh produce. Other questions? Alex, Craig, Rachel, anybody else on the line? All right, hearing none. Alex, you have any more questions?
Just
one off-topic question, if I may, Madam President.
Just a moment, Alex. Let's take the on-topic questions. Craig, you got any more questions on topic?
No, I don't, so thank you.
All right, thank you. Rachel, do you have any questions, other questions on topic?
I don't. Thank you.
All right, Alex, what's your off-topic question?
I was just wondering if you could give us a small update on some of your federal lobbying efforts for an additional stimulus, just whether the last few weeks have made you more optimistic or less optimistic that help is coming that's going to be able to help the county bridge some of its revenue losses.
Okay, so the question was, what's happening on the federal level? The National Association of Counties, along with the League of Cities, the National Mayor's Conference, have been lobbying in Washington for support for local units of government around lost revenue. For Cook County, 65% of our revenue is economic activity dependent. So it's sales taxes, it's hotel and motel taxes, it's amusement taxes, it's car rental taxes. So the fact that the economy kind of fell off the cliff as a result of shelter in place means that those categories of revenue, those revenue streams will be heavily impacted. So, and it's not just Cook County, any municipality that depends on these kind of sales taxes and use taxes is going to be impacted as well. So these national organizations have been coordinated in their efforts in Washington to press Congress for a stimulus package that supports local units of government that have lost revenue. We were assured that this was a priority for Stimulus Bill 5. I can't predict whether or not it'll be included in that stimulus package. I'm surely hopeful that that's the case.